The statistic that matters to me is that 4 to 5 people every week in this small community decide that life is no longer worth living.
The good news is that suicide is very preventable, and we do a lot of that at Capital Area Counseling.
Capital Area Counseling Services is a accredited mental health and addiction treatment center, providing services to people in 9 counties in central South Dakota.
We do many things, but it's really all directed at people having better futures than maybe they've experienced in the past.
There are lots of mental health centers throughout the country. There are 11 of them in South Dakota. But really what drives the innovation in our organization is need, and the need is there.
There was a time back in the mid-90s when we had a streak of suicides that we didn't understand at the time and we don't understand now. I believe it was a major news outlet that called us the suicide capital of the country.
We had lost the ability to have a crisis center in our local hospital. And when we lost that capability, the only thing that was left to us was people being handcuffed, put in those patrol cars, and hauled to jail and then on to the Human Services Center.
There was a need for leaders in our community to respond. And what ended up happening was we formed the Pier Fort Community Mental Health Task Force.
That is a collaboration of many entities, the Ministerium, Capital Area Counseling, the Hughes and Stanley County Commissioners, the Pier Police Department, the Pier School System, all working together.
And we really took on the challenge of, now that we don't have a crisis room, what are our options? What can we do?
And we have a system that is working, and it's working remarkably well. It's called Mobile Crisis Response.
We go to where the crisis is happening. We go to wherever that might be, whether it's a person's home, a person's backyard. We've been to motels.
80% of the time that we go into the home of an individual with a mental health crisis, where that individual is thinking about taking their own lives, we're able to leave them with a safe-at-home plan. No more police intervention, no trips to the jail, no trips to the Human Services Center. It's walking into situations where there are too many unknowns and bringing stability to the situation. And we have tremendous leadership and tremendous staff, compassionate staff.
You need to hire the right people and then get out of their way and let them do their work. The folks that we have at Capital Area Counseling are not only excellent in their craft, but they're willing to share and volunteer across the state to help other mental health centers and addiction treatment agencies, but also at a policy-making level. Our highest priority is preventing suicide, and everything else that we do is about strengthening families and helping people be happier in the life that they have.
If we can get people to simply walk in the door, we know that we can save that life.